Hi, welcome to Health Advocates Ask the Expert series, a monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. Annual open enrollment is now in progress for many people. So today we're joined by Dr. Raffi Terzian, Senior Medical Director at Health Advocate, to talk more about best practices to make this process as easy as possible. Thank you for joining us.
Happy to be here.
So how have recent shifts and changes in healthcare impacted open enrollment?
Well, with the implementation of the Affordable Care Act, that has created a whole new set of questions for consumers who are trying to decide about what kind of health plans they should be in and their choices. That, combined with high deductible health plans, have made consumers more interested in making sure they get the most for their healthcare dollar.
Absolutely. So what are some best practices that HR and benefits managers can keep in mind to help support employees during this sometimes challenging time?
I think one of the most important things is communication.
Sure.
Particularly around communicating any new plan changes, plan design issues, and giving people enough lead time so they can do the research they need to do to understand what plans they're going into.
Because people may not realize their plans change year to year, even if they keep the same one.
Well, that too. Plans can change. Plans change not only in terms of dollar amounts, but in terms of features that are covered under plans.
Sure, it's important to know. So how can a service like Health Advocacy help both the employees and their employers?
So with respect to the employers, we're here really as a resource for the human resources professionals who are looking for help in helping their employees understand what are the differences between different plans. How do I choose between the plans? So we can be a help to the employer in that way. For the employees, we offer a whole range of advocacy services. So while they're going through the open enrollment period and understanding different plan options, you know, one of the things for surgery, for instance, if they're planning a surgery, we can help them better understand what their out-of-pocket expenses might look like, depending on which plan they choose. And our advocates are able to ask questions that the employee may not have thought of. So as they're in the course of that conversation, you know, we make sure to try to ask all sorts of questions around those plan choices, and help people understand if they, you know, what sort of things do they anticipate they might run into from a healthcare standpoint. Also, once they become enrolled and active in a plan, to be able to support them through all host of different types of advocacy services, whether it be claims and billing support or personal assistance from a nurse. We're able to help with that.
Be able to tell them if their doctor's in network and what's going to cost them.
Exactly. So we would research that and explore that on their behalf. Sometimes folks have been with a particular doctor for a long time who is in network, and then if the plan is changing or transitioning, they want to know that they can continue to see that doctor, or if not, what decisions they need to make about that. And the same is true for pharmaceuticals, for instance. So they may have been on a particular drug for many years. That's the time to start talking to their doctor about alternatives, potentially, or if they're going to remain on that there are no surprises. They understand how it's going to be covered.
Absolutely, and an advocate can be a big help for that.
Absolutely.
Ask those questions you may not think about all the time.
That's right.
So how does Health Advocates specifically help organizations during open enrollment?
So we help, one, we know ahead of time, because the organizations have provided us with the information about what the plan designs are going to look like. So we can take a look back to the plan before and look at the new plan and sort of help people make sort of get a comparison view of the plan and help them understand where things may be changing or where things are going to be the same. So that's one of the key ways I think that we do that. So we are available as a resource during that very busy open enrollment time for both the company and for the member who's making choices to help them sort through that. And again, we want to be a partner for them down the road as well once the new plan takes effect to help navigate them through the system.
Great. Well, thank you so much for joining us.
It's my pleasure. Thank you.
And thank you for tuning in. We hope you found this helpful, and if you like what you heard, you can follow us on our social media pages below. Thanks again, and we hope to see you next time for another edition of Health Advocates Ask the Expert.